Dr. Tom Roselle live right now, 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live in studio. It's cold, but it's beautiful outside, and you need to bundle up if you're going to get out there, but it is worth getting outside. I'm here at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that has your mind. Perhaps you've had a problem. You've tried, you've applied, you've done everything you know what to do, and you've come up with, guess what, nothing that works. Here's an opportunity. Pick up the phone, give me a call, 888-630-9625. Let's talk about what's ailing you from a natural point of view. Let's increase your wellness index. Let's upregulate your body and make sure that it's working the way that it's supposed to work. Broadcasting 105.9 FM, WMAL, and we'd love to talk to you about anything that is affecting you. So, but guess what? I've got always things to talk to you about, and that's what we're going to start out with because, you know, there's so many things in the news, and I'm constantly reading, and patients come in on a day-to-day basis, and I'm lecturing all over the country, and questions are asked, and they're kind of similar. You know, whether you're a doctor, whether you're a patient, whether you're just a person that is interested in all this stuff, well, we see trends, and trends get back to basics, and basics are those things that we look at and answer the question, why does something happen? See, most of you get treated from a standpoint of symptomatology. This hurts, this is sore, this is hot, it aches, you got this kind of cramping, you have diarrhea, whatever it is that you have. The spring's coming up and your head's going to plug up. All those things are just symptomatic presentations. It has nothing to do with the why. So what my job is to help you understand that there is a why behind everything and anything that takes place. So what we're going to do is we're going to open up the coffers today, and we're going to look at why from structural, chemical, emotional point of view. And those of you who read my book or listened to the audio version know that I'm very serious when I say that your health is in your hands. Your health is controllable. Your health is simply the end product of all those things that have accumulated up until this point in time that have affected you, things that you've done that perhaps you shouldn't have done, things that you didn't do enough of, things that you weren't aware of, and sometimes either, you know, because of serendipitous situations, you found yourself in one of those conditions that, you know, you are where you're at. Well, my job is to let you know that as long as you're breathing, you can turn all that around, and that's what we're here for. So we're going to look at things today. We're going to talk a little bit about arthritis. We're going to talk a little bit about inflammatory reactions. We're going to talk a little bit about diabetes or blood sugar purges. You know, so what's that all about? They're all the same. They come from a very similar type of situation. Up until quite recently, joint arthritis, which we call osteoarthritis, whether you have it in your spine or you have it in your hands or whether you have it in your knees or you have it in your hip, was thought to be wear and tear traumatic induced. Well, what we really know and what I've known for many years is that any form of arthritic problem, no matter what, is an autoimmune condition. It is your body's immune system having been messed up for a long period of time, finally taking its toll, and you need to understand the why behind all this thing. Did you know that about 52 to 55 million Americans are diagnosed with arthritic conditions, and there's a whole lot more of you sitting out there that you have the problem, but you really don't understand it because your doctor doesn't understand it and you really don't know what to do about it? Well, we're going to talk about really understanding the problem today. So there's 50-some million people of you out there that already have an issue. That's over 15% of the population. And there's a whole lot more of you that are going to end up with a problem. So arthritis and immune function. So what does that really mean? So let's think about the inner workings of your body. You know, we're talking about the way your heart pumps. We know that it pushes out all kinds of things, you know, through the blood vessels. When I say all kinds of things, you say, well, it just pushes out blood cells, and it pushes out, you know, the red and the white, and, well, not necessarily that's the end of the story. So here's what the deal is. It pushes out your blood cells, and there's things that are attached to it. There's oxygen and exchanging with carbon dioxide, and it keeps you functioning, but it also has nutrients going through it, and it also has, in some situations, unfortunately, a lot of junk, a lot of garbage in your system because it goes through your mouth, you breathe it in, you absorb it through your skin, and it gets into the system. So, unfortunately, you become the end recipient of either neglect or unknowingness, and you have a problem. So when everything is perfectly timed and working at its top level, all parts of your body are working like this beautiful orchestration, this harmony, this interchange of actions and reactions, but then something happens. So something goes wrong, and it causes the body to go crazy, and it gets hot, and it starts breaking down, and we have this deal called autoimmune disorders. But autoimmune disorders is the underlying sewage pit, if you will, that you fall into when you don't do the things that you should be doing. So with an autoimmune disorder, when a person's body produces abnormal cells, and there's a very general test, it's called anti-nuclear antibodies, ANA, which, by the way, is it shows up in a lot of things, from infections to viral invaders to cells that aren't being produced the way they're supposed to. And what these guys do is they turn and attack the body. They go after you. They eat it up. And the ANA cells, once they've become, wrongly, they identify the body in a bad way. And so they start breaking the system down. They don't recognize healthy cells from bad cells. And the tissues and the organ systems that are supposed to be working the way they're supposed to work to defend you get attacked as well. So your immune system becomes confused. It doesn't know what it's supposed to be doing. And it poorly works after that, even to the point where of defending you against bacteria and other viruses and so forth. But in the meantime, it's destroying you. It's breaking your organ systems down. It's eating you up. This is a problem with something called T cells of the immune system. So it stands to reason that anything that we do that does not affect the internal pattern of T cell memory, the confusion that takes place, and only addresses the symptom process is not going to work, and actually over a period of time is going to make things much worse. It's going to make things deadly for you. So, what are kind of immune function? We talked about arthritis a little bit, but rheumatoid arthritis, we're talking about osteoarthritis now. There's things like MS, multiple sclerosis, and it's an immune problem that goes after the central nervous system and the peripheral nerves, the sheath that surrounds them. It's called the myelin sheath, and it destroys it. And it can cause all kinds of problems. I mean, not only paralysis and loss of muscle tone and function, but disability and death. We're talking about inflammatory bowel disease. We're talking about Crohn's and ulcerative colitis. We're talking about lupus. We're talking about psoriasis, scleroderma. We're talking about Sjogren's. We're talking about fibromyalgia. We're talking about diabetes. And something as awful and deadly as ALS, or what's commonly referred to as Lou Gehrig's disease. And all of these things are autoimmune problems that attack and affect the body. You get something like Sjogren's, and, it hardens the body. It causes the eyes and the mouth and all the skin surfaces to get really dry and tight and hard. But it also then begins to cause degenerative disease of the spine. When you see a Sjogren's patient, you're going to see that they have a multiple attack affecting the immune system from structural, chemical, and emotional. And you're going to see that they've had stress patterns, and it goes on. Same thing with fibromyalgia. Symptoms include, severe fatigue and ache all over the body. And by the way, fibromyalgia does not affect joint spaces. There's a distinguishing feature there that you really need to know about. There's stiffness in the joints, but the joint spaces are spared. And there's all kinds of other things, but we could spend the whole program just on that. Years ago, I wrote a white paper called Fibromyalgia, the Undisease, and because it's really, at that point, was not easily identifiable, and it just showed up as symptom processes, but in fact that there were things, but most physicians didn't go after them. It was mostly identified by ruling things out instead of really identifying. But when you looked at cortisol levels, when you looked at serotonin and dopamine levels, and you looked at, if you went in and actually did a biopsy of the muscle fiber, you would actually see that there was in fact a identifiable hard base evidence that said this patient does have fibromyalgia when you add it together. So, but let's talk about arthritis and autoimmune more than anything else, because we could get into each one of those and spend the rest of the program on, and that wouldn't be fair to you. When you're dealing with an arthritic condition, if you go into the textbooks, the information is overwhelming, and mostly it's treated with autoimmune suppressors, and it's treated with pain control medications. It's treated with anti-inflammatories and so forth. But without asking the question, how did all of this start? So do you suffer with arthritis or some other immune function? Do you have pain? Do you ache? Do your joints swell? Do they get hot? Do you just, you can't function? You're always in some sort of discomfort? Well, it can be an arthritic condition. It can be other things too. But if it is arthritis, we're learning more and more, whether it's gouty arthritis or psoriatic arthritis or whether it's osteodegenerative arthritis, and the list goes on, by the way. If you ever got in Dorland's Medical Dictionary and you looked up arthritis, you would see just your mind would go, really? There's just that many types of things? Yeah, the truth of it is there's that many types of things out there. But it's autoimmune related. Autoimmune diseases cannot be cured with a drug. It cannot be cured with a drug. Let me say that again. Autoimmune diseases cannot be cured with a drug. But your body can cure anything. It is my belief, and my experience over 35 years of practice, that if you put into motion the right process, the body is extremely forgiving and it will turn itself around. Autoimmune diseases have to be looked at from structural, chemical, emotional pathway, what's affecting it. That answers the why. It was their injury, multiple repetitive injury in the presence of inflammatory disease within the body and a stress level that continues to build up. Are you a, sugar, sodas, coffee, fast food, fried foods, alcohol, gluten, additives, preservatives, junkie, where you're getting high levels of acidic types of foods, causing your body to continue to be inflamed, causing your body to try to put things out by dumping stuff in it? Well, there are tons of brand new research substantiating what I've been saying and other practitioners in the wellness community have been saying for many years, for decades, that these conditions have to do with all those things that we've been talking about. So when we look at the initiators, all of a sudden we see that there's a trauma, somebody gets hurt, or we have an infection of some sort, or we end up with an uncontrolled amount of stress because we don't know how to handle it. We end up with an arthritic condition. All of a sudden the person can't walk around. They can't move. They can't function. But yet there's other people out there who suffer the same slings and arrows, if you will, and they don't have these problems. They don't end up with those conditions. So how do we deal with them? How do we deal with what we know now to be autoimmune reactions across the board and all of the different schools, from Harvard University to Stanford to San Diego Immunological Centers? A guy by the name of Len Stans, he's not an MD, he's a PhD researcher. They're all on the bandwagon, really understanding now that this isn't an autoimmune reaction. The problem is that from a medical point of view, they keep trying to put the fire out instead of understanding how that autoimmune piece came about to begin with. And as we go through the program today, you can understand that when I talk about blood sugar reactions and spikes, that it has the same underlying reaction and cause as any type of autoimmune reaction. When we talk about, and if we mention heart disease, there's an autoimmune reaction that's taking place there. Why is it that my culture, I'm Sicilian, doesn't have all the arthritic degenerations overseas that it does here when we come to this country? Why is it? Why is it that we have a dietary pattern that is very supportive and unfortunately is not here? You're listening to Dr. Tom Roselle live. I am in studio. 888-630-9625. 888-630-WMAL. Love to talk to you on any subject you have your mind. We're touching the bases on autoimmune reactions and how they affect you, but more importantly, why they come about. And that's the piece of information I want you to get by the end of the program today. I want you to understand that you had your fingers in it, one way or the other, and if you really understand the process, you can put the fire out, but you really got to get it to fix it. This is February, and this week on Tuesday is Valentine's Day. And one of our sponsors, Thermography Centers of Fairfax, is going to help you guys buy your ladies a very interesting gift. Thermographic imaging is critical in identifying years before the presence of the mass of breast cancer. It shows the blood supply, it shows the heat image, it shows the inflammatory reaction, way before any other mode of diagnosis is going to pick it up. Only this week, only the week of Valentine's Day, Thermography Centers of Fairfax will offer the initial breast scan, normally $225 for $198. That's $225 now, $198. If you'd like to take advantage of that, give them a call at 703-943-7248. That's 703-943-7248. Guys, what better gift could you give your lady to show her how much you care about her and how much you love her? Give them a call, 703-943-7248. Let's go to the phones. Jack, how can I help you?
Hello, Doctor. How are you doing today?
Pleasure, my friend. What's up?
If I may open the call to you and all my fellow listeners, may 2012 be our best year yet.
Oh, God willing.
May our best days always be ahead of us, never behind us, and may the Lord be with you and yours.
Thank you, my friend. I appreciate
Absolutely. I wonder about the dosages of vitamin D. I remember you mentioning it in a previous broadcast. I believe, if I didn't mishear you, what I remember hearing was 4,000 to 6,000 international units minimum. And you said a minimum with a great deal of enthusiasm, just like that. And I went to decide to look around. I thought, I never thought about how much vitamin D you take. Let me take a look. When I kept finding out from medical sites and those claiming to be doctors, I see claiming, I'm sure they're doctors. I don't know if they actually wrote the article. I read on their website. That was what I'm thinking of getting at there. 2 to 2,500, considering you come from supplementation as opposed to diet or sun exposure, is the top end for recommended dosages to avoid toxicity. I wonder if you can help bridge that disconnect.
Yeah, absolutely, Jack. That's called CYA. That's called cover your back end. And so what you need to understand about that is that any manufacturer, if you look on a vitamin bottle, it's going to tell you about 400 units of vitamin D. And that's not anywhere near enough. See, the problem is, where we live particularly, is that between September 1st and May 1st, the sun is at such an angle that it doesn't stimulate the cells to generate the vitamin D that we need in the body. It just doesn't happen. You can be outside all day long. Now, the range that we look at in laboratories are 32 to 100, and most labs will tell you that's normal. Well, the problem is, and if you go in and you really do your research, you're going to see that anything under 50 is considered insufficient. When you hit 32 and anything lower than that is called deficiency. So how do you get it up? It depends on age. It depends on dietary patterns. But, for example, when I'm trying to restore vitamin D function in a patient, I want to get them up ultimately to a range of about 70 to 80. And I'll do that in some cases if they're really low in a deficient area, and depending on how old they are, I may get them up to 10,000 units a day, sometimes 12, sometimes 8. But for maintenance, I take on a daily basis anywhere from 4 to 8,000 units of vitamin D, depending on what my diet's been, depending on if it's wintertime, whether it's summertime. Summertime, I'll probably take 4,000, 2,500, maybe sometimes 5, because I work inside all day long. I don't get outside in the middle of the sun. But this time of the year, we're all in trouble. So you can take, depending on the base of it, sometimes it's in a soy oil, sometimes, you have to, what your body can handle and can't handle. If you got somebody that has a problem with gallbladder function or pancreatic function, I'm going to give them something that is in a hard form, something that is from a vegetable base. Somebody that I may give them cod liver oil, and so they can have a combination of A and D. But generally, most of us living up in this area, we can get away without any trouble whatsoever around 4,000 units a day this time of the year and not have any problems. But I always will tell a patient, let's get that blood work done, and then 100 days after you start supplementation, go out and have that blood test repeated to see how close you've gotten to that level. Some people need to get in front of a sunlight to be able to do it, and they can't raise their vitamin D. Some people have problems with their intestinal tract. They can't absorb it. Anyway, Jack, I hope that helps a little bit. If you need a little bit more information, get a hold of me at rosellecare.com, and I'll go back and forth with you. Thanks for your call. I appreciate it. You're listening to Dr. Tom Roselle live. I'm in studio, 888-630-9625, 888-630-WMAL. Love to talk to you about anything. We've got a couple things on our plate, and hopefully we'll get you at a place where life can be a whole lot better. Isn't that great music? I just kind of love it. I'm digging it. Thank you, Rick. I appreciate that. Got a couple calls. We're going to take them. We're going to get back to our topic, and we're going to talk a little bit more about actually T cells and how they affect their body and why they're a problem. Mary Kay, how can I help you?
I was diagnosed last Thursday with a sudden sensorineural hearing loss, And so naturally they have me on high-dose prednisone. I was wondering if there was anything else I could be doing to help myself. I know the prednisone's probably sending you off the ceiling right now.
Yes, it is. I'm trying to be very kind and very nice, but yeah, absolutely. I mean, it's destroying every bone you have in your body and it's shutting your immune system down, but on top of that, it's fine.
Yeah, it's also making me dizzy and stupid, but...
let's talk about it. I promised myself that after last week that I would be more calm this week, regardless of what the questions was. And prednisone's another one that can send me over the edge.
I figured as much.
Mm-hmm.
But,
Mary Kay, listen, here's the deal. How old are you?
59.
All right. Do you have any history, genetic background of hearing loss, particularly in female side of your family?
Not that I know of.
Okay.
All I had was a high-frequency hearing loss, but I was an Air Force pilot for some years.
Okay, that tells you probably where it's coming from. First of all, yes, there's some things that you can do. In traditional Chinese medicine and acupuncture, you look at different meridians that supply that area. You're going to look at the kidney qi and so forth. But in our history, things like niacin and acupuncture, low-energy light laser, but also taking the compression off the upper cervical spine can also help. You can, depends on what your hearing charts show, whether you can restore any of this. I don't know.
It's 50 to 60 dBs across the range.
Okay.
The entire range.
We probably can, you probably have a chance of stopping it, but you have to look at dietary pathways. You have to look at things that will affect your neurology. And as I said, acupuncture works very well. Manual manipulation of the upper cervical spine will work. But you have to use them.
I'm fused C5, C6, but you'd be thrilled about that.
That's not a problem.
Okay.
I mean, you can adjust anywhere around that. You know, as a pilot, you sustain a lot of G's, and those G's take a beating in the spine.
Yeah.
I've got a lot of guys that come in that I treat on a regular basis, living in the Washington area, that have sustained that over a period of many years, and they end up years later a mess.
Well, arresting this is of no interest to me in a way because it's useless. And if I could get, if that's going to happen, if my hearing just stays where it is, I would just as soon get rid of the hissing and the distortion at high volume levels. And that's, That's possible. But I can't tell you in your particular case it'll work because I don't know enough about your background. I don't know other medications. I don't know what's transpired, how it came about. The fact that you've been around aircraft obviously is going to make a difference. Like guys that are shooting, I have a hearing loss in my right ear because I was a kid. I was out shooting all the time with shotguns. And go ahead. Yeah, this started with a huge hiss in my head, so I know exactly when it happened. It was very bizarre.
Okay, so one of the things I would tell you to do before you even made an appointment to see me or anybody else is go get yourself a time-release niacin. All right, and take about 500 milligrams of niacin and take it with your meals because even if it's time release, which slows down the flushing, the side effect is that you're going to get really hot for about 15, 20 minutes.
I know, I hate it. I've done it before.
Okay, but if you take it with your meals, it's not an issue.
Okay.
And it'll be less of an issue. And so try that first. Decrease anything that is inflammatory in your diet. And I'll just give you my mantra. Sugars, sodas, black coffee, fast foods, fried foods, alcohol, gluten, additives, preservatives, so forth. Okay, because all of those things are highly acidic and they cause inflammation straight up. Pork, red meats. If you're going to drink alcohol, keep it to red wine and see what happens. And make sure your water intake on a daily basis is half your body weight in ounces, and put a little lemon in it because the lemon is alkalizing.
Really? That's weird, huh?
Yeah, it converts. It's one of those crazy things. Lemons will do that, and organic apple cider vinegar will do that. They both convert alkaline in the body, and there's other foods that will do it as well.
Oh, cool.
But give it a try. See what happens. You can get a hold of me, at rosellecare.com, and I'll be more than happy to go back and forth with you. But in my experience, we've seen a lot of different types of hearing loss, and it depends on how it's affecting you, but what other markers you have that have to do with B12, which also is a soft indicator of inflammation and the like. So try that. Give me a call, and if I can help you, I'll be more than happy to.
Okay, well, thank you so much. I really appreciate your time.
You're welcome.
Bye-bye.
Deborah, what's on your mind? How can I help you?
Hi, yeah, I need my knees done, number one, and I know that I've been told I have arthritis, but I don't know which one to get done, but the doctors are saying I need to lose weight. The bottom line is, the doctor tells me that I have a fatty liver, and the only thing that I'm getting from her is you just need to lose weight. I don't know which way to go.
Well, let me ask you a couple questions. Can you walk without pain?
No.
Okay. Is the x-rays show that it's bone on bone?
Yes.
All right. How old are you?
I'm 56.
All right. So here's what can happen. I've seen many patients over the years with degenerative diseases of many joint spaces, from the knees to the shoulders to the hands to the spine. And there are things that can be done, but you have to take significant action. And what I mean by that is this. You have to dramatically change your dietary pattern. I've seen joint spaces restored using chicken cartilage and the different types of glucosamines and so forth. But, I mean, significantly restored, maybe, depends on the patient. Weight has a huge contribution. It's going to cause other joints to break down. It's not good for you, and you're going to end up with all kinds of things, including other inflammatory reactions. As we're talking about arthritis happens because of joint space instability superimposed on a system that is inflamed. And if you don't put the fire out, that's just one of the things that's happening. You're going to become very osteoporotic if you're not now. You're going to end up with hardening of the arteries if you haven't already. You're going to end up with diabetes if it's not already on its way, particularly with a fatty liver.
Mm-hmm.
So you've got to make some changes.
Yeah.
You can turn virtually anything around to the point where it's going to support you, 100% resolution. Philosophically, ideally, yes, but what you want is to be able to restore your health. Now, whether you need to have a knee replacement because the pain is so awful at this point, I haven't seen your x-rays. I can't tell you that. I don't know.
It's gotten so bad that I'm using a scooter.
Okay, well, then you probably don't have an option. But I'm telling you that if you don't do these other things anyway,
yeah,
you got a problem. You're going to make life a lot worse than what it is right now, and you're going to take away the quality of anything that you have left.
Right.
So do yourself a favor. If we can help you, you let us know. Okay. But the bottom line is you've got to change, and you've got to do it yesterday.
Right.
Deb, thanks for calling. I appreciate your call. Scott, how can I help you, sir?
Yeah, I talked to you about a year ago about iodine for a child who, basically the school wanted to code as autistic, but, he's not autistic. Anyway, when I started iodine, he hadn't talked for almost 4 years, and he started talking a week later. Now, my question is, what's the upper limit for iodine if I have a 75-pound child? Is 225 micrograms too much, or is that about right?
No, it's not too much. Matter of fact, depending on the situation, we may even dose it higher than that. But iodine is one of those things that most of us are very deficient in. And if you don't deal with it properly over a period of time, you end up with all kinds of things, including Hashimoto's thyroiditis and other autoimmune problems. But how old is the child?
Well, he's a giant human being. He's not quite 5.
Okay.
And he's 40. He's a little bit over 4 feet tall already.
It's going to be a big boy.
Yeah. What's interesting is my cousin's 12-year-old, who's been on 3 ADHD drugs since about 7 or so. I had her, she asked me, and I said, okay, here, put him on a plant food-based multivitamin and then some iodine, and she reported that she's seen a change.
Yeah, there is changes. I mean, the normal recommendations for children are in the neighborhood of somewhat like 75 to 80 micrograms up to about 150 to 160. And it's the way I dose, I have a tendency to dose a little higher, but you can go to 150 and be well within normal limits. But you can also go higher therapeutically, particularly when there's a deficiency level.
Well, I watch his skin because what I read is that if there's too much, you can have some acne breakout. His skin doesn't seem to show any issues.
Yeah, you can get acne because of the effect that it has on the liver. Mm-hmm. But most acne problems are either intestinal tract or liver mediated, because the liver's responsibility is to handle hormones, and the intestinal tract is about toxicity, so they both go hand in hand. But I wouldn't worry about that. You're well within the normal limits, and just see what you get, and then run a test periodically. With our patients, I mean, I may dose without a test, but I follow up with a test immediately just to see where our levels are, because you have to make sure you have other balances. Iodine is critical for thyroid function, but it also, you have to have tyrosine, and tyrosine competes with two organ systems deal with it. One is the adrenal glands, and the other one is thyroid. So you have to balance it, and the two have to have a synchrony.
How do you get tyrosine in your diet or through supplements? Is it a specific supplement?
Well, there's tyrosine's an amino acid, and okay. Well,
I get plenty of that through chlorella. I take chlorella every day.
Okay, now well, not necessarily. Are we talking about you, or are we talking about?
Well, I believe in his. Yeah, that's a good question. I do. There is some multivitamin stuff that I put in there.
For example, I dose, if somebody needs tyrosine, I'm going to dose it about 500 milligrams of tyrosine a day, and sometimes higher than that. But it depends what the amino acid deficiencies are. And I'm not telling you to do this. I'm just telling you that there's a balance that has to be observed and it depends on what organ system that you're trying to affect. So my suggestion to you, if you really want to get this handled properly, there's in our office, either Sue, who handles is the head of our nutrition department, you can make an appointment and she can do a phone consult with you, because I understand that you're down at Chesapeake, and she can walk you through this. She can tell you exactly what tests to have done, and I think she can get you on the path that you need to go.
Okay, well, Doctor, once again, thank you very much. And just my final
you're in Burke. I'm sorry. I was looking at the screen wrong. Excuse me. Yeah, but give us a call. I mean, we're more than happy to help you, Scott, anytime.
Well, yeah, just the other thing was, it's so frustrating when parents ask me my advice, and then they say, well, I'm not going to do that because the doctor never said anything about iodine or testing for iodine. Or.
Hey, Scott, join my world. Have a great day, buddy.
All right, man.
Good to talk to you. Interesting. Got a couple more calls, and we will get back to all of you, hopefully, before the program's over. But let's talk a little bit about these T cells. And there's several of you out there that are handing me notes and saying, so what's the deal here? Well, it's simply your body's immunological reaction to stuff that it can't identify as being you. And you have to handle it properly. One of our callers talked about degenerative knee disease, and if you're going to restore any joint space, you have to have a low level of inflammation in the body. You have to have the right nutrients going in. You have to have the right amino acid balance. Boron and glucosamines are extremely important, particularly the sulfate form of glucosamine. You see so many of these products out there that have glucosamine hydrochloride and so forth, and chondroitin hydrochloride. It's the sulfate ion that actually gets into the joint space to repair it. It's a larger molecule, but it gets in, but if you have an inflammatory response, guess what's happening? Your joint space receptors are being blocked. You can't transfer this stuff. You can't get it in. So you've got to shut down the inflammation. And if you do it with steroids, if you do it with prednisone, if you do it with any of those drugs, you go down a slippery slope that begins to take your life away. Glucosamine is a component of cartilage that we've known for a long time that helps repair the tissue, but the problem is it doesn't work because so many of you are on NSAIDs, non-steroidal anti-inflammatories. You're on things like prednisones. You're on many arthritic drugs, and what it does, it competes, and so it's like just tossing your money down the tube. If you're going in for surgery because you have no joint space left, well, there's things that you have to prepare for. Like the lady that called us, I told her, if she has a weight problem, she can't go into that surgery overweight because we're talking about bleeding in the joint space, we're talking about blood vessel injury, we're talking about potential infection, we're talking about all kinds of things that can be avoided if you take the time to restore normal function. We gently talked about blood sugar problems, and I said at the beginning of the program that these have to do with immune problems and immune conditions within the body, meaning lack thereof of your immune response. So, what's diabetes? What is blood sugar handling problems? Well, there's a lot of definitions out there, but it really has to do with this. Either you have a chronic level of high blood sugar above the normal level, above 99, and it stays up there, and actually 99 can be a problem for some of you as well because the normal range is between 80 and 90. That's our ideal functional medicine range. Or you have blood sugar spikes. That means that throughout the day you get things that go through the ceiling, and those can be damaging. If they last an hour and a half to 2 hours, even though that they come down, they're doing damage. They're destroying your tissue. You're listening to Dr. Tom Roselle Live. We've been in studio at 888-630-WMAL, as we are every Sunday at 12 o'clock, bringing you the most up-to-date information as we possibly can in the world of integrative and wellness care. This is the place where you get it right, and you can ask your questions about anything, whether it's coffee or the bad stuff you're eating or how do you get out of this fix. And, you know, a lot of times I tell you go look in the mirror, because there's the problem. It's you. It's the choices that you make. It's all the stuff that you are refusing to deal with. So we talked a little bit about disease risks of high normal blood sugar. So if we get into a high normal, we stay in the high normal, your doc says, well, you know, don't worry about it. Well, guess what? Cancer, cardiovascular disease, cognitive impairment, kidney disease, neuropathies, diabetic retinopathy affecting your eyes so you can't see anymore, pancreatic dysfunction, all of those things can be your gift from not controlling your blood sugar or saying, oh, it's not a problem, I can stay on medications and not a big deal, right? Wrong. So 26 million of you are considered diabetic, and there's a ton more out there that are pre-diabetic, and a whole lot more of you that go into diabetic spikes that your physicians are missing completely, that they're not even aware of because they don't get you at the right time. So they say, well, don't worry about it, not a problem. Well, I'm telling you, I'm here to tell you that it is a problem, and a lot of it's because of what you're putting between those lips, my friends. You know, if you are not keeping your body alkaline, if you're not getting exercise, if you're not learning how to control that headspace of yours, to keep control of your emotional state and work on it every day of your life, because it is an ongoing process, life is not going to be pleasant. And I want life to be well for all of you, because if you don't, the trade-off is not good. Ralph, how can I help you, sir? Thank you for calling, and calling from such a long ways away. Chesapeake.
Yes, Chesapeake Beach. Yes.
Can you hear us down there, or are you on the computer?
No, I hear you very well over the radio.
Fantastic.
Yes. 3 years ago, I'm a 73-year-old male who had a kidney transplant a little over 3 years ago, and doing very well. Got a very good live match thanks to my wife, and of course I'm on immune suppression drugs.
Right.
I'm on Prograf and Cellcept.
Right.
And through these last 3 years, other than a herpes type 1 infection on my optic nerve, which they took care of with Valtrex, I have had no infection, problems. And I'm wondering, so beyond that, and I assume that these are probably these two drugs that I'm taking are T-cell suppressors.
Yes, they are.
My kidney healthy.
Right. So here's the deal, and I only have a few minutes. I wish you had called in earlier. We could have spent a little bit more time.
Maybe next week.
Okay. But the problem is that it's going to suppress your immune reaction to a lot of different viral elements, number one. It's going to increase your risk of all the other types of diseases that we talked about.
Right.
So you're going to have to live, as they say, proverbial, at the foot of the cross.
Yeah.
You got to be a perfect guy dietarily. You've got to learn how to really handle your life to minimize the effects of this thing, and there's ways of doing it. I'll tell you what, give me a quick note at rosellecare.com, and I'll give you some more details on it, and I'll also give you a couple people that I know down that area that might be able to help you.
Yes, I'm being treated presently. My nephrologist does very good. I have the full panel blood work and creatinine level, and my creatinine level's done well.
Ralph, I got to stop you. Okay. I've got a break. Thank you for your call, buddy. Let's talk again.
I'll see if I can drop your line. Thank you.
This is Dr. Tom Roselle. See you next week. Bye.